Hi everyone, it's the cardiovascular pathology and cardiovascular pathology in USMLE exam have 10% MCQs. So if you want to clear the USMLE exam, right now we are discussing here first of all congenital heart diseases. Congenital heart diseases, for example, cyanosis, which is blue babies, disorders when the color of the babies change. The color of the babies change due to oxygen because there is lack of oxygen in the fetus. And then the skin color blue, that's the blue babies, and become evident immediately after birth, and it's from parental prenatally, it's from the parent disorder. That is the most common congenital heart disease. Others, which is persistent truncus arteriosis, is the truncus problem. When truncus arteriosus fails to divide into pulmonary trunk and aorta due to failure of aorticopulmonary septum formation. Other, which is tetralogy of Fallot, tricuspid atresia, when caused by anterosuperior displacement of the infundibular septum, most common cause of early childhood cyanosis. There are fourfold in pathology of Fallot, which is pulmonary infundibulum stenosis, most important determination for prognosis, and second one, which is right ventricular hypertrophy, and third one, which is overriding aorta, and the last one, which is ventricular septal defect. These are the fault in the heart when during birth age, during childhood conditions, some defects which is due to these persistent truncus, arteriosus, transposition of great vessels. We know that there is 5 great vessels in the heart. First of all, I want to explain the structure of the heart. Heart have 5 blood vessels, large blood vessels that spread in the whole body, and heart have 4 borders, and heart have 2 parts, left side and right side. The 5 blood arteries, which is superior vena cava, inferior vena cava, aorta, pulmonary artery, and pulmonary vein. And these, when development can happens, arteries, some major arteries defects that is cause the transposition of great vessels. They means shunt happen between the right ventricle and left ventricle. Tricuspid atresia, it means the tricuspid valve and hyperplastic right ventricle requires both atrial septal defect and ventricular septal defect. Other, which is Epstein anomaly. What is Epstein anomaly? Did you know? I want to explain you that displacement of tricuspid valve leaflets downward into right ventricle, artificially atrializing the ventricle associated with tricuspid regurgitation, accessory conduction pathways, right-sided heart failure. That means when the right side heart failure happens, that's the reason of Epstein anomaly. Congenital heart disease continuously happens due to, we know that I explained you that left to right shunts means acyanotic happens, means that when ventricular septal defect is greater than atrial septal defect, that's the cause of shunt. Ventricular septal defect, how the ventricular septal defects happen? Asymptomatic at birth, may manifest weeks later or remain asymptomatic throughout life. Most self-resolved blood lesions may lead to left ventricle overload and heart failure. Means the left part of the heart have overload that causes the heart failure. Did you got it? That when left part of the heart have overload, left ventricle have overload, that's the ventricular septal defect. Atrial septal defect in interatrial septum and wide fixed split. Ostium secundum defects most common and usually an isolated finding. Ostium spinum defects rarer and usually occur with other cardiac anomalies. Sometimes symptoms range from none to heart failure and distinct from patent foramen aware if that septa are missing tissue rather than unfused. When right atrium and right ventricular oxygen saturation increase, pulmonary arteries also may lead to paradoxical emboli, means embolism happens in the systemic venous conditions. Emboli is a balloon like means the wall of the venous due to pressure have problems. That's the cause. And they bypass atrial septal tract to bypass lung and becomes systemic atrial emboli associated with Down syndrome. When Down syndrome happens, it's due to Down syndrome. It's a defect. Down syndrome is a genetic defect that causes atrial septal conditions problems. Patent ductus arteriosus. Patent ductus arteriosus. It's in fetal period and pulmonary blood flow increase due to this condition. Well, it's not in this condition, but pulmonary vascular resistance decrease. Shunt also become happen from left to right, and in fetal period, shunt is right to left. Normal in neonatal period, pulmonary vascular resistance happen, and it's it happened due to birth, after birth. Mostly it happened after birth. As a Menger syndrome, it's pulmonary blood flow and pulmonary arterial hypertension, and in this condition, coarctation of the aortic narrowing in this condition happens. Risk of cerebral hemorrhage increase, and other which is congenital cardiac defect associations. There are four genetic defects in cardiac association. One is Down syndrome, other is Turner syndrome, and Williams syndrome and Morphin syndrome. In Williams syndrome, supravalvular aortic stenosis happens. In Turner syndrome, bicuspid aortic valve coarctation of the aorta. Morphin syndrome, thoracic aortic aneurysm, and Down syndrome, atrioventricular septal defect. The uh, previous page, I also explained you atrial septal defects, which is Down syndrome. Common causes due to hypertension. Due to hypertension are the leading cause of failure organ, the leading cause of heart defects. There are two types of hypertension: primary and secondary. And in primary, it's the most happens automatically, but secondary is caused due to any disease, due to any problems in human body, and like we have ischemia, we have stroke. It also if cause effect on the heart. That's the reason. And hyperlipidemia signs when plaques have produced in the uh, arteries when due to lipids. Thomas, we said arteriosclerosis when hardening of arteries with arterial wall thickening and loss of elasticity. We know that medical student also knows this information that it is important for arteries to become elastic. More elasticity, more normal level of blood flow from one place to another place. But there is hardening of arteries that cause leading problem of circulation in the body, and it is known as arteriosclerosis. Atherosclerosis, otherwise, when it is very common. Actually, atherosclerosis is very common. A disease of elastic arteries and large and medium-sized muscular arteries. Atherosclerosis, which is very common, disease of elastic arteries and large and medium-sized muscular arteries. It's in the abdominal aorta. From abdominal aorta happens due to coronary arteries, and when coronary arteries means complete artery, carotid artery, it means it happens in the circles of wheels. Circles of wheels means we have in the abdominal regions a lot of arteries that short